Andrew Longhurst is a health policy researcher and PhD candidate at Simon Fraser University, and he recently wrote an op-ed in the Tyee about, was titled, BC Needs to Get Serious About Omicron. And I mean, why wouldn't we? I mean, just yesterday, December 30th, we had 4,383 new cases of COVID-19 in BC, and Public Health Officer Dr. Bonnie Henry admitted that they're probably 4 to 5 times higher than that. The numbers only reflect those that have had PCR tests. So, I mean, it's getting pretty dire in British Columbia. And so I'm going to talk to Andrew about his op-ed. Welcome to the interview, Andy.
Great to be with you, Markham.
Well, look, you sort of laid out the case against Dr. Henry. And before we get into the specifics, I want to ask you a question because you're in the, sort of the health research field. Over in Alberta, Dr. Dina Hinshaw, the chief medical officer, sort of, Dr. Bonnie's equivalent there, has been on the hot seat for at least 6 to 8 months. She has been criticized by doctors, by nurses, their associations, by researchers and scientists. I mean, she's been under the microscope. And Dr. Henry, on the other hand, whose policies are actually very similar, has not received an iota of that kind of public criticism and public scrutiny in British Columbia. Why do you think that is?
There's a number of things going on. My focus is looking at the political and economic dimensions of healthcare policy making and understanding politically and kind of institutionally why certain things in healthcare policy happen the way that they do and why not other ways. And so I think from my perspective and taking that lens, I think coming into the pandemic, I think the Jason Kenney government was, for many reasons, there was a lot of anger and frustration about a lot of his policies across the board. And so I think in many respects, the Kenney government was an easy villain. And I think a lot of that anger and frustration has been directed at Dr. Dina Hinshaw and senior public health officials for how they have responded or not responded to the pandemic. So I think there's that political piece to it. I also think in Alberta, there is a bit more of I'm an American, I'm a dual citizen, and I think there's a little bit more of a louder culture, if you will, and sort of folks, Albertans sort of don't have a lot of time for nonsense. And so I think in that respect, maybe you could call it political culture or just sort of a different sensibility culturally within Alberta's politics and how people have become frustrated with the pandemic. And so I think that's certainly one reason. I think in BC it's different. The institutions here are different. I think there's been a particular kind of performative politics of how Dr. Bonnie Henry presents herself. I think the image that she has and folks have cultivated, I think that has played a significant role as well.
Yeah, fair enough. And there is definitely a culture. We cover both provinces. And so I foot in both camps. I often call myself a dual citizen, BC and Alberta.
Yeah.
But one thing, things happen here that don't happen in Alberta. For instance, the Doctors Association here has gone out of its way to dampen criticism. And individual doctors are very reluctant to criticize the government or Dr. Henry personally in the media. Well, let's get on to some of the specifics. And one of the first ones is you think that the province should adopt a vaccine plus strategy, by which you mean don't rely just on vaccines, or that we need sort of the Swiss cheese model. We need a whole bunch of policies that are not perfect, but line them all up together, and they are like Swiss cheese. But that's the metaphor. So yeah. What do you mean? So what do you mean by adopt something other, a vaccine plus strategy?
Sure. So we're going into year 3 of the pandemic, and we've seen again and again with subsequent waves that just relying solely on vaccines, I mean, to be fair, not that whole period hasn't been a time of having vaccines, but the waves that we have seen, most recently Omicron, and before that Delta, we've seen that vaccines alone are insufficient to reduce or stop transmission in the way that we need to. We now with Omicron have we have realized that 2 doses are insufficient because of waning immunity, and so we need third doses. So it's become evidently clear that we can't just rely on that one intervention. And I think in many Western countries, of high-income countries, wealthy countries, there has been a reliance on vaccines as the thing that will save us and get us out of this. It's become clear that that's not the case. And in fact, we have a whole array of other tools in our toolbox that we're not really using, and where we are using them, we may not be using them very effectively. So that means ventilation. We know that this is an airborne pathogen. We need to respond to it accordingly. We have a large body of evidence that tells us COVID spreads when aerosols accumulate in poorly ventilated spaces, and they can reach dangerous levels. So ventilation again, effective and tight-fitting, efficient masks, often called respirators or N95s. And then from there, we need to use widespread testing and other interventions to help facilitate a better approach to getting out of the pandemic, but not just relying on vaccination.
Now let's talk about the fact that COVID-19 is airborne. So what that means is that when you breathe out, if you're infected, you breathe out droplets, which will fall within 6 feet. That's certainly the case, but you also exhale these little tiny aerosols that will hang in the air like cigarette smoke. They accumulate in a room, and that is the primary means of transmission of infection. And we at Energy Media, we have interviewed scientists all over the world, in the US and Europe and Canada, about the science around this. And very often I ask the scientists at the end of the interview, when did you think the science was settled? And invariably they say, well, either before the pandemic started or just shortly after it began. And yet Dr. Henry, like other public health officers in Canada, up until the last couple of weeks, refuse to acknowledge that and base their policies on that science. So what's your take on it?
I think there's two things. There's a stubbornness within infection prevention and control as a discipline within our healthcare system. So these are the folks that are determining who and when and what context you should get certain levels of PPE, personal protective equipment, including respirators. That discipline is wedded to the idea that that COVID-19 is spread through droplets and not through aerosols, and that remains stubbornly a dogmatic view. Unfortunately, it's going to result in preventable deaths and disability, and that's where we're at, and that's very upsetting. I think the second piece to this is it's pretty clear we're at a point in this pandemic when a lot of the responses that we're seeing are being made with political and economic calculations in mind. So when you say COVID is in the air, it is because we're sharing air, it's airborne, and being very clear and definitive about that. It has implications across society and across different economic sectors. So I think there's a narrow, and I would say this, which is unfortunate, there's a very narrow-minded and short-term view that by acknowledging that it's airborne means that in all of the spaces where we share air, whether that's restaurants or schools or whatever, whether it's public sector, private sector, there are interventions like improving ventilation, placing HEPA units in places with poor mechanical ventilation. There's a whole number of interventions that may cost money. Some of them don't, even just cracking a window or a door. These are low cost improvements. But I think there is a belief that all of this is going to cost money, and so we're not going to do it. And so I think this sort of ideology of fiscal austerity, which is dominant in a lot of provincial governments across this country, that by saying this, it acknowledges that there are expenditures that government will have to cough up. And so I think that's part of the reluctance. But on the other hand, I think when you think longer term, and I think we're seeing this in places like Japan and East Asian countries that are taking the airborne nature of COVID very seriously, it actually creates more certainty for the business sector. And I think we're going to get to a place where we're going to see the smarter folks within the business sector realize, hey, actually having CO2 monitors in my restaurants to reassure patrons that they're in a space that's well ventilated and they're at lower risk of becoming infected, this is actually good for business. I don't think we're there in much of North America, and certainly not in BC, because there's a very narrow-minded short-term view that it's going to be either a cost to government or a cost to business. And I think we need to take the longer-term view that you can actually have a thriving business sector, but these are interventions that we're going to need going forward.
Early on in the pandemic, the Conference Board of Canada convened a group of economists to advise on how the federal government and provincial government should manage these policies in order to have the best impact or best outcome for the economy. You know what they said? Do not open and close, open and close, open and close. The policy that we have followed was determined by those economists almost 2 years ago to be the worst way to do this. On the other hand, I interviewed Dr. Lindsay Tedds from the University of Calgary about 8 or 10 months ago, and she said the best way to protect the economy is to give businesses and governments to give consumers confidence. So the things that you mentioned, such as improving ventilation so the air turns over 6 times in a room instead of twice in an hour, putting in HEPA filter equipped air purifiers, making sure that everybody's got good quality masks, those sorts of things. That's what actually gives people the confidence to go out and shop without thinking they're going to catch, fearing that they're going to catch COVID-19. Anyway, long time.
Absolutely.
Yeah, Energy Media viewers will know that we've got a COVID-19 playlist on our YouTube channel, and you can see all of those interviews with those experts making these points there. So, well, let's go on to the upgrading of tight-fitting masks and respirators. And Andy, here I want to make the point that even just yesterday, Dr. Bonney did a media interview with CTV and sort of downplayed masks and downplayed N95s. And you would think that 2 years into this, she would have learned.
Yeah, it's really, it's quite disturbing, frankly, at this point in the pandemic, when we have a tool in front of us that we know is effective. We know it's a path out of the pandemic, and yet we have a number of different arguments that often get used to say, well, this is why we won't do it. I think there's an intense stubbornness. And then I think there's also, there's this view, and it's particularly bad in BC, of that scarcity. Sort of scarcity is the way we operate in BC. So there's this understanding that, well, if we say you need an N95 in healthcare and congregate settings, that we're going to have to set some limits on that. And we don't have a shortage of respirators or N95s manufacturing capacity, even in this country at this time. We don't have a shortage globally. That was the case early on in the pandemic, but we have overcome that. In fact, I've heard that there are manufacturers domestically that can't fulfill, that have unused capacity, manufacturing capacity, because the federal government and provinces haven't actually taken them up on their offer to expand production. So the point here is that they are readily available. We're not following the science. And I think there's a mix of a dogmatic view that is very well entrenched within public health in much of this country, and in infectious among IPAC practitioners, who are the ones that hold the keys to the N95 cupboard in most hospitals. And then I think, again, as I said, I think for governments, there is that political and economic calculation of, well, then that means in schools, that means in all of these congregate settings and workplaces, we need to be treating COVID like an occupational disease, which it is. And that means there are regulations, and that that government needs to intervene. And I think we're seeing increasingly that governments want to sit back and they don't want to take responsibility for protecting their citizens. And I think that's very concerning.
Well, speaking of protecting our citizens, I mean, across Canada, there's been tremendous concern about sending kids back to school next week. Now, Dr. Bonney did extend the holiday by a week or 10 days. So it'll be a little bit later for kids to get back to school in January. Nevertheless, the kind of stuff we're talking about would, in fact, protect children in schools. We saw the state of Victoria in Australia, but 51,000 air purifiers to put in one in every classroom across the state. We don't do that kind of stuff. And well, let's talk about testing and data. I mean, BC doesn't test as much. It has the lowest testing rate of any province, and has throughout the pandemic. And then the last time I interviewed you, we talked about the quality of the data. The government fudges data, it hides data, it won't release data. I mean, this ought to be a provincial scandal, ought it not to be?
Yeah, I mean, I'm just the extent to which we have serious issues around data transparency, data quality. I don't need to go, the list goes on. I don't need to go into all of that. But what I maybe to flip this around and be to tell us, where do we need to be going and where ought we be going is we know from a large body of research literature in organizational studies, in healthcare policy, that the best health systems, the highest performing health systems are the ones that are learning health systems. They're the ones where learning and improvement is embedded across the culture of these organizations. And this extends more widely to government, not just healthcare organizations and the health system itself. And I'm seeing a real resistance, an absolute resistance to learn. We're now going into year 3 of the pandemic, and the basic interventions based on what a large body of literature has shown us, whether it's respirators, whether it's ventilation and air purification, whether it's the importance of testing, all of these interventions, rather than improving and getting better and learning from our mistakes, we seem to be refusing to acknowledge that we failed and wanting to deny that there's a problem in the first place. So to me, that's profoundly upsetting, and I think it should be upsetting for a lot of citizens, because we're in such a complex environment right now that we're likely, and I would turn to people that have expertise in this area, but there are a lot of people saying, we have Omicron, but the next variant that we're most likely seeding, which is already probably out there, may have full immune escape, meaning the current vaccines that we have provide no protection. And I think that's the reality that we have to face. And if we're not going to improve the fundamentals of pandemic response and management, again, ventilation, good and high efficiency masks, testing, tracing, supporting, isolated, paid sick leave, all of these interventions, rather than getting better at them, we're seeing with Omicron, we're actually going in the wrong direction. And I think that's very troubling from, for so many reasons, not just death and morbidity as a result of COVID.
Yeah, let's talk about messaging here, because even just over the last few days, Dr. Bonney has been saying that Omicron may in fact be the signal that the pandemic is coming to an end and we'll be shifting over to endemic status. And that kind of messaging, I mean, as you say, we could very well be gestating another variant off in some other African country or somewhere, in Asia, somewhere else where people aren't as vaccinated.
Or right here.
Or right here. And we now we're into the 5th wave. We may very well have a 6th and 7th wave, or who knows how long. And there's that kind of messaging that Dr. Henry has over and over and over again. It's been mixed messaging. She's been downplaying the threat and so on. And the government of John Horgan simply stands behind her. They say, nope, we support her 100%. Dr. Henry is doing a wonderful job. And your take on that?
I think the evidence is pretty clear. We've seen enough waves now to know that it's rinse and repeat. The cycle is just going on and on. And I think so many people are so weary. Our healthcare workforce is at the brink. I don't say this facetiously, but when I say we're not going to have a healthcare system if we continue this up, because we're just burning people out, and they're going to say thanks but no thanks, I'm out of here, and that's happening. So I think the issue here is we continue to engage in magical thinking in British Columbia. There is there appears the inability and unwillingness to look at early signals from other jurisdictions. We continue to hear the language used that we are managing our quote unquote own pandemic. We continue to wait to help to try to demonstrate and prove within public health in BC that that these variants are intrinsically different when they reach our borders in British Columbia. So there is this magical thinking that is pervasive, and when it doesn't turn out to be the case, then we see a number of games being played with the data. Or, we've been waiting months now. Penny Daflos from CTV got the government to commit to providing full hospitalization numbers, which includes those that are in hospital because they're currently infectious and those that are no longer infectious but still needing hospital care. Back in October, government finally committed to providing those numbers, but they still have not disclosed those and have made no further mention of where those full numbers are going to be and how they'll be provided to the public. So there is, now we're in this place where it's more about managing public perception of the pandemic rather than confronting the reality that's right in front of us. And I think that's incredibly disingenuous to healthcare workers. I think it's incredibly disingenuous to the public because we're engaging in really kind of a fantasy. And I think for our democratic institutions, and I've talked to you about this before, you erode, and I wrote about this in the Tyee piece, you erode trust in your government and in your institutions by saying things and acting in certain ways that completely are at odds with the reality and lived experience that people see every day. And so I think governments can't, when we study political history and we see governments behaving in this way, it causes a lot of issues, least of which is it creates a huge amount of resent and mistrust because people feel like they're not actually being told the straight story. And in fact, they're often not. So I think it's a real, I said in the piece that government risks losing the public's trust. And we're at such a critical point where, we need to be honest and frank, but we're still not getting that.
Well, thank you very much, Andy. This is a very difficult conversation because it's been a long time coming. Dr. Henry has avoided criticism up until now. Premier Horgan has avoided criticism, but I think it's long overdue and much needed. And I unfortunately don't see, like you, I don't see much likelihood that either the government or Dr. Henry is going to change course anytime soon. So thank you very much for this. Happy New Year, and we'll look forward to further interviews.
Thanks, Markham.